I'm Dr. Alex Rajput, and today is Sunday, June 5th, 2011. I have the pleasure of interviewing Dr. Ali Rajput, who is an honorary member of the Movement Disorder Society. We are here at the 15th International Congress in Toronto, Canada. So this is a rather open-ended interview, I've been told. So we can start with the past and then progress to the present and then to the future. So would you mind telling us about your early years as well as your education? I find it a fascinating story of someone from a small town in Pakistan that's made their way to senior level in movement disorders.
Bill Weiner was very clever to ask you to interview me because I can't bluff you. You'll catch me on that thing, so I think I better tell you the whole truth. Okay. Nothing but the truth. Okay. Well, the early part of it really is not very pertinent to the North Americans because they wouldn't understand it, but since this is a worldwide society, I will tell you where I was born and where I grew up. I was born in Sindh province, which is part of Pakistan now, but it was part of United India before there was India and Pakistan. So I'm not sure if I call myself Indian or Pakistani or Indo-Pakistani. But then it became Pakistan, so I was in the same province. I didn't migrate. I was born in a village which has no name. Now that might surprise you too, but it's true. What happened was that in 1900, some farmers from Punjab area were given land in Sindh area. Punjab is another province. So they were given land in Sindh area. They were given, each farmer was given 32 acres. So my grandparents from both sides of the family migrated from Punjab to Sindh. My paternal grandfather and my grandmother were in village number 30. That's where I was born. And my maternal grandparents were in village number 24. They had no names, just number. The village was about 200 people. They were pretty well all related, different cousins, but they were all farmers. Everyone was a farmer. The village really didn't have much of an educational background. To give you some idea, that from 1900, the first half of the century, there was only one person in that village of 200 who finished high school and university. I mean, nobody else finished even high school. So I was the second person to come along to finish high school, university, and the first one to go into medicine. So it was quite different for me, but I was naturally gifted compared to the other guys. It didn't take very much to be top student. When you're there 5 or 10 students, you're the top. So it wasn't very hard to be a top student. So I was a top student in my class. The education system was such that either you could go up to grade 7 in that village, but you couldn't go to high school if you went that route. Or if you wanted to go to high school, then you have to move out after 4 years. And there was no age limit who could be in your class. I was the youngest one because my mother didn't want me to stay home. I was just too troublesome. She said, go to school. My uncle was a teacher. She said, take him to school. There was no age limit. I was in a class where kids were 4 years older than I was, but it was okay, So after 4 years, then we had to decide, my parents had to decide what to do with me. And they decided that he should go and learn English and go into high school. Well, that's when they sent me away to another place, which wasn't too far, but it was far enough that we only came over the weekend home. Didn't come home every day. Excuse me. So that means that I was living with boys, or 8 or 10 boys. Well, it was tough, The boys were bigger than I was and older than I was. They were always picking on me, His parents must not love him. They sent this little guy up, and I really felt sorry for myself. I said, yeah, they are right. If my parents loved me, why would they send me here? Well, anyway, so my dad came visiting for the first time, so we sat down, Dad and I. And my dad, I should tell you, he had only grade 3 education from grade 4 he left. But he was probably one of the wisest men that I have known. Very, very wise man. But anyway, he sat down and asked me, how are you doing? And I started crying. I said, why are you crying? Is anybody bothering you? You need anything? He said, no, I feel homesick. He said, oh, you feel homesick? Come right over, son. I got water buffaloes. I got farms. Come right over. You'll be at home. Well, I wiped my tears. I said, don't you worry, Dad. I'll be fine. Because I hated water buffaloes and I hated the farm. Well, a few more fights with the kids, and I was settled. There was no problem there. But that was for 2 years. And that 2 years really were a learning experience more than anything else, being away from home. I didn't do any work. We were just going to school and coming back playing cards. That's all we did. But next year came that I knew my parents weren't rich. They could they could use some help, and that's in the form of scholarship. So I had to appear in a scholarship examination, which was competitive in the district. You went to another city where you appear in scholarship exams from the whole district. You know, probably 70, 80 students who were top students that come there, and they had about 10 scholarships. So you competed. So I did compete, and fortunately I passed. I got the scholarship. So from then on, the high school became easier. High school was really from anywhere grade 5 up to grade 11 was considered high school. Now while I was there in high school, I did well. I was a top student. And the headmaster, we call him headmaster rather than principal, headmaster of the school got to like me. He became my father figure in the high school. He would send me his personal paper to come and so I could read. Where the food he thought was lacking, he would send me extra special milk, etc. So he was very good, and you met him. You met him when we went to Pakistan. He remained very fond of me, and I remained very fond of him. So the high school went, and again I finished at the top of my school. From then on, I went to university, and that was not very good because the first year I was sick, very sick, almost died. Had typhoid, a lapse of typhoid, and then on to pretty well the whole year was sickness and recovering from that. Barely made the first year. So I had to do some work in the summertime. My brothers would go catch frogs so I could dissect them. So I could catch up with the first year's work. So in the second year it was tough. I had to do 2 years' work, but I did make it and got into medicine. And medicine itself was in a college, we call it college rather than a school, medical college called Liaquat Medical College, which was in a city called Hyderabad, Sindh. And there, it was okay. Everything went all right. It was a 5-year medical school, and I finished at the top of my class. So that was nice. You wanted me to tell me more about that after that? Are you done with that?
Well, why you succeeded through high school, got into medicine? Why a career in medicine as opposed to something else?
Well, I wasn't good at most of the things.
Well, I know you wanted to get away from the water buffalo and farming, but
well, I wasn't really very good. I had wanted to change the course from pre-medicine. We had 2 years of pre-medical and 2 years of pre-engineering. Those were the two professions that the smart kids went into. So when I was in high school, there were 2 other boys who were in competition with me, but somehow I managed to beat them. They were very bright kids, but somehow I was on the top. And they both were going into pre-engineering at the same college, and I was going into pre-medical. So they told me, said, you know, you beat us in high school because the subjects what you're liking. If you were in engineering, we will show you what it is. So I said, I'll show you what it is. So I went there and changed my courses to pre-engineering. Well, that was fine. So I go home and sheepishly tell my dad, I said, Dad, I've changed my courses. He said, what? So pre-engineering. He said, who told you that? I said, nobody. Go change it right away. Yes, sir.
So how old, you were what, 18?
Yes. 18. Well, no, younger than 18. It was more like 16. So I changed the courses, and I told my friends, I said, I wish you luck. Just let me go where I want to go. So I went into medicine. For some unknown reason, it was thought that medicine was an honest profession. You could do something good for people, and you still can make a decent living. And I didn't mind having good clothes, which I saw the doctor said, and doing something good for people. So it turned out that I liked medicine. Actually, I was really one of the crazier ones. When I finished medicine, I studied this, I was doing internship there, and this was 9 months of internship, means 9 months of call. That's it.
So straight call. So this would be foreign for most people. So 24 hours a day
24
available.
hours a day was on call. That was it. But there were other guys who were on call, and they would at times want me to take their call. I would take anybody's call. And I did the same thing when I moved to States. Anybody who wanted that call to be taken out, no payment. You don't have to repay me. You don't have to pay me any money. I'll take the call. So medicine was really fun. I have enjoyed every bit of it. It has been fun. Plus, I have been satisfied with what I'm able to do. I did about 9 months of private practice after the 9 months of internship in Pakistan, and it was highly rewarding, financially, emotionally, except one part. The one part that was difficult for me was charging people who didn't have the money, and they had to pay from their own pocket. And these were poor people. These were really poor people. You could see that. How can you charge somebody who is going to sell his last goat to pay you? So I had one heck of a time charging them, so I would find all excuses why I'm not going to charge you. Either I hurt their ego, that you're too poor, I'm labeling you as too poor, or they're interpreting that I'm giving them second-rate care. Neither one of them was true. So I'll have to find excuse. You are from the same village that my father is and I am. You work for my father, you work for my cousin, my brother. There's no way I can charge you. You are my mother's third cousin, so I can't charge you. So that was the most difficult part that I did. But I was making money galore, lots of money. To tell you the honest truth, I've never made that much money since I came to North America. I made more money there. It's hard for people to believe it. There was cash on the barrel, and no problem.
So you had your nice clothes. You're willing to give up money and take extra calls. So there's something a little bit different here. So how did you go from wealthy private practice in Pakistan over to North America?
Well, I told you that I finished at the top of my class, and I had a friend whose name was Kareem Abbasi, who was my classmate. And he finished medicine a few months behind me, but then he went straight to States. And after he was there for about 6 months or so, he wrote me a letter. He said, I hear you are rolling in money. He said, someone like you should be doing some postgraduate work. So I had already decided that I wasn't going to go to England, that somehow I had decided, no, I'm quite happy being where I am. But I said, how do I come to America? So he was already there, so he told me how to do that. There were ECFMG examination to write. And I asked him where. It used to be in Philadelphia, the address there. So he gave me that address, or was it Evanston, one of the two places, Illinois or Philadelphia. Maybe there were two. Both names seems to ring a bell. But anyway, I appeared in that exam, went to Karachi and did a few days off from my practice and the exams, and I passed. And then I asked Kareem, I said, well, where do I go now? He said, well, you apply to the hospitals. And I said, well, what kind of hospitals are there? He said, they are hospitals which give you full maintenance, which means they give you room and board and white uniform and some spending money. So I didn't like cooking. I just wanted something to eat. I wasn't going to be a chef. So I said, okay. So I picked 5 hospitals in different areas where I applied, which had full maintenance. That was a major consideration for me. And I got 5 offers. So now I had to choose where to go. And So I wound up going to Chicago, Michael Reese Hospital in Chicago, because it was, that's where Kareem was, in Chicago. But by the time I got there, Kareem left. So I was in Chicago by myself.
What year was this?
1960.
Okay, and you started when, July 1?
July 1.
Okay, and this was long before days of internet and having easy access to what's going on in the world. So you packed up and you said goodbye to your family, and you arrived Chicago, ready to work. So what was that like?
It was a hilarious thing. See, I had friends who were doctors, of course. I had friends who were lawyers. They were all educated, and now Kareem had left before. I don't know how he got there, but my advisors were slightly different. So they told me Chicago was very cold. I have to be ready for Chicago. So I go to Karachi, get a 3-piece woolen suit made, and a double-breasted, thick wool overcoat. Said, let the cold come. I handle it. So I arrive in Chicago July 1st, and I have this overcoat on, and I'm drenching with sweat. People are looking at me, where did this thing come from? Well, anyway, I wiped my sweat. There was this fellow, a black fellow, who was very kind. He knew I was lost, totally lost. He said, where are you going to go? So I told him where I was going to. So he put his own dime and called the hospital. He said, there's some lost soul here who wants to come to see you guys. So they said, send him over. I don't even remember if I thanked that man properly. I know I didn't give him 10 cents back, but I want to thank him, how kind he was to me. So then I went to Michael Reese, and that's where it was a nice hospital. We used to have 49 interns. I was only from the Pakistan or Eastern countries. There were 2 English, 2 Mexicans. 44 were Americans, so we knew it was a good hospital. So that's the first time I competed against head-on with the American graduates. And there were some very, very bright kids, from all the major universities that you can imagine they were there. So that was my initiation into Chicago. I won't tell you my shopping trips because they were slightly different.
I want to ask about the cooking trips or the cooking adventures with you and your friends. You won't have time for that, but I don't think your cooking skills have necessarily improved much with time.
No, they haven't really. I tell my grandchildren there are 2 things. 1 is talent, 2 is effort. I can make a lot of effort, but I have 0 talent.
Something to be overcome. So you spent a year at Michael Reese Hospital,
right.
And then where did you go after that?
I didn't know how the system worked. When I was about a couple of months there, 3 months there, there was only one other Pakistani who was doing pathology residency. He was older than I was. His name was Khalid Hamid. So he was very kind. So he asked me what I was going to do next year. I said, it just started. What do you mean what I'm going to do next year? He said, now you make arrangements for that. Oh, that's what I'm supposed to do? So he became my advisor. So the rotations that I had gone through, some surgical rotations, I had this dream of becoming a famous surgeon. But I had no surgical bone in my body. I had no skills. So I said, no, that isn't going to work. So I settled on medical specialties. So Khalid Hamid, he said, no, you can be a gastroenterologist, they need in Pakistan. You need to be a cardiologist, you can be in Pakistan. You can be a urologist, kidney specialist needed. You could be a neurologist. I said, there are no neurologists in Pakistan. I'll be a neurologist. That's how the decision was made to become a neurologist.
Had you had much neurology exposure during medical school? Zero. So just whatever came in through your general
Whatever
medicine.
came, I thought, I could, a little bit of work I could do.
So then you decided neurology is for you based on the fact there weren't any neurologists in Pakistan?
That was really the main consideration. As I said, it wasn't, I didn't think it was easier than other topics, or more difficult. I just said, they need neurologists in Pakistan. I'll be one of them. And I just went to neurology.
And then you applied in your first year through to neurology
No,
residencies?
not after that. When I was in Chicago, one other consideration was that Pakistan did not accept the American degree. It's a Commonwealth thing, but they accepted Canadian degree. So I had to gear all my training so I could pass the Canadian exam and then go back. And that meant that I had to have some other training, whatever requirement of Canadian certification. We used to call it fellowship at that time, Canadian Royal College Fellowship. So from Chicago, when Khalid Hamid told me I have to do something next year, now I very promptly went up to the head of the department, whose name was Dr. Rahmil Levine, a very nice man. So I said, Dr. Levine, next year I have to do a year of medicine. Where do you suppose I should go? He said, where do you want to go? I said, I don't know. He said, if you tell me where you want to go, I'll get you there. But I said, I have no idea where to go. So he said, okay, I'm going to New York, and I'm going to be Dean of College of Medicine, as well as Head of Medicine. If you want to come with me for a year, I'll take you with me, and from there you can decide where you want to go. So I said, thank you. That decision was made. So I went with him to New York, and I was at a hospital called Metropolitan Hospital now for a year. While I was there, then I had to decide about neurology training and what to do. But I didn't have any background in psychiatry, none whatsoever. And the 60s, neurology and psychiatry were quite intertwined. For example, my chief, Dr. DeYoung, was trained psychiatrist as well as a neurologist. And head of psychiatry at Michigan was a Dr. Wagner, who was same training. One became head of psychiatry, one became head of neurology. So I thought, that came a little later, but I thought I should have a bit of a background in psychiatry. So I did a year of psychiatry in a state hospital, just getting exposed to it. There was no psychiatry in Pakistan either. While I was still doing, I was maintaining contact with Dr. Levine in New York. So I then decided that I'm going to apply for neurology. And I applied to different places, but my heart was set on two places, University of Iowa or University of Michigan. The reason was that SARS was a big man in neurology from Iowa. He had written a book, and I read that. And DeYoung was a big man in American Academy of Neurology. He had written a book. Well, I didn't know Iowa, I didn't know Ann Arbor, It was just, so I just flipped a coin and I said, I'll go to Ann Arbor. So sight unseen, they accepted me. Ahead of me, there was an Indian fellow, Raj Janeja, who had done very well, and they thought, I will do well too. Well, I guess they got disappointed.
And you kept your double-breasted wool suit for both those places? It gets colder in the winter.
Well, I learned that there's summer in Chicago, so I had to learn. I didn't wear that outfit in the summertime again. In the wintertime I tried, but...
So you started neurology residency in Michigan in 1963?
63, okay. Yes, 1963. It was a 3-year program, of course, like all the programs were at that time. I had done a year of medicine, a year of psychiatry, a year of rotating internship. So I had 3 years under my belt before I got to Michigan. And it was, when I started, I was the bottom of the heap, totally at the bottom of the heap. The students knew more than I did. And I was really embarrassed. So I knew I could do it. I had to work hard, So I decided there's a voluntary work hard and there's a whipped up working hard, that you're whipped, you don't have a choice, you have to work hard. So I decided that what I'll do is I will enroll myself in a master's program at University of Michigan that was offered by the university to the residents in neurology. So when I applied for the graduate school for master's program, they said, yeah, we'll have you. But the fees were more than I was getting for my salary. So I had to tell them, I said, I can't afford it, So I went to my chief. I said, Dr. DeYoung, like to do that, but I can't afford it. Unless you pay me more, I can't afford it. So he wrote to them, to the university postgraduate school, said, treat him as in-state student, and the fees are nearly half of that. If you're in-state student, then out-of-state student. So I was the Michigan in-state student, and I did my master's. The advantage of that was that I had to interact with some major scientists there. I had to learn something which I wouldn't learn as a resident. It forced me to do that. So by the time I finished my 3 years of residency, I had my master's in neurology too. So that's how I got done. And they were actually, the U.S. was very kind to me. They allowed me to stay 1 more year. As J visa holder, I was allowed for 5 years, but they allowed me the 6th year so I could finish my program.
So you finished your 3 years in your master's 1966.
66, right.
And then you said you have to pass Canadian exams to go back and go to Pakistan and work as a neurologist. What happened next?
Well, the next thing was, of course, I had to take a Canadian exam, and the Canadian exam was not a very pleasant exam, I should tell you that at that time. It was an essay type exam. You had 5 questions and you write 5 questions. There was no options available. It was the only subspecialty which had only fellowship, no certification. It's a high academic level. And I had heard terrifying results of that, so I had really studied hard. I said, I want to pass that exam. But one of the things that they told me was very, very much asked in the exam was neuropathology. So I decided that I will do a year in neuropathology in Canada. So I went to, this is an interesting story in itself. I went to Dr. DeYoung, who was my head of the department. I said, Dr. DeYoung, I have to go to Canada and do neuropathology for a year while I'm taking my exams. So he said, well, there is Toronto and there is Montreal. They usually take their own kids. How about Saskatoon? That's the first time I heard of the word Saskatoon. So I went home and looked on the map. It was at the North Pole. I came back to Dr. DeYoung. I said, I've been here for 3 years. Have I been that bad that you won't send me there? So he started laughing. He said, no, it's actually a good program that I have heard, because Oshevsky, you know, Oshevsky-Richardson-Steele syndrome, he was head of neuropathology in Saskatoon at that time. He said, he said, good thing about it. I said, no, good or bad things, I'm not going to North Pole. So instead I went to Kingston, Ontario, but before I came to Canada, I had a friend in Ann Arbor from East Pakistan. At that time it was East Pakistan, now it's Bangladesh, Abu Haq, who was a resident in pathology. Abu had moved to Montreal, and he was my advisor on how to move. So he said, you know, instead of coming as a student, which they will allow you to come, why don't you ask them to give you an immigrant visa, just in case you don't happen to go for some reason and you want to stay here, you wouldn't have then problem. So I wrote a letter to the Canadian government. I said, you know, I would like to have an immigrant visa. I said, yeah. I don't even remember filling out any forms. You know?
Different times than
Yes.
2011.
Well, maybe I was just such a good guy.
That's
you know,
true. They could have. So you got an immigrant visa to come to Canada.
That's right. That's right. And so for a year I was in Kingston doing neuropathology, and that was a year pretty well dedicated to exams. I had to appear in my written exam. It was separate. As said, you know, there were 3 exams, 3 written exams. Each had 5 questions, and you asked the 5 questions, answer the 5 questions. Somehow I got through that, and then if you passed that, then there was an oral exam. That was in November. This was in September, the other one was in November. So I went to Montreal, and I was very lucky I passed that, because they gave me a patient like the one I had never seen before and never seen since, Unverricht disease. And the patient couldn't talk. To make matters worse, they gave me history which was wrong. So I spent a good half hour trying to get two things straightened out from that patient. Once I got it straightened out, I had the diagnosis. I said, I know what it is.
This was in fall of 66?
66, yeah. Fall of 66.
So you passed your exam, November, all things done, and you finished your neuropathology residency in...
No, that will be finished in July.
That was in July.
July 1st, 1967.
Okay.
I still was under contract.
Okay. So you were there for a few more months. And then what
Right,
happened come 1967?
Well, first of all, when I passed my exam, there was not the current regulations. There were a lot of people who passed the exams, they left after that. So, and there was rumor that I might leave. And so I said, there's no way I'm going to leave. They've been so good to me about it. So I went up to my boss, and now I had a higher qualification on paper than he did. He was a neuropathologist, but I was a FRCPC neurologist. So I went to him and said, David, I have passed my exam, and I'm most grateful to you. But I want you to understand one thing. I will not leave 1 day earlier than my contracts expires. I said, I'm here, just tell me what to do. And we remained very, very good friends. We have remained very good friends. So while I was there, and then I was now ready to go to Pakistan. So I applied to Pakistan. I wrote to the Minister of Health, I am ready to come. The neurologists are quite excited that they will be welcoming with open arms. Well, the minister's letter was like that, And he sent it to the Director of Health, whose letter was kind of a little less enthusiastic. And I said, I said, keep in touch with him. So I'm now in touch with the Director of Health. Well, the Director of Health then, the next letter was a bit less warm, and the third letter came. Well, when there's an opening in Pakistan, we advertise the position, you apply for it. So I thought that was great. In Kingston, I was going to get a bulletin from Pakistan Public Service to apply for. So I knew they didn't want me. So
and they still had no neurologists at that time.
Well, very few. If they had 3, 4 in whole Pakistan, that was about it, So then Abu's advice came quite handy. Now I had to find a place to live. My residency was finishing, so but I didn't know Canada any more than Kingston. I was just there. The rest of Canada was just a blur to me, From Kingston, I had gone to Toronto. I had a friend here, Robin Humphreys, who was head of neurosurgery in a children's hospital. He was doing neuropathology, same in Kingston, so we became friends. So I knew a bit about Toronto, a bit about Montreal, because Abu Haq was there, and Kingston. But, Kingston was where I knew, but I didn't know any neurologists. So Kingston had, there were 2 neurologists. One wanted me to stay there, one wanted me not to stay there, so I knew they were fighting. I said, I am a new guy. Why do I want to get involved in anybody's fight? No matter what I'll do, they will both be mad at me, probably suspecting I'm siding with his. So I said, no, I don't want to stay here. I want to leave. But where do I go? Well, I didn't know Canada, so I couldn't really make commitment to any place. And moreover, I didn't have a license in Ontario. Now, this might come to you as a surprise. At that time, there was a rule. The College of Physician Surgeons of Ontario had a rule that they will not give a license to Indian or Pakistani graduates. Would you believe that was a rule?
Just for people from that part of the world,
Well, I don't know if other parts of the world, but those specifically were not allowed, so I was not allowed to have a license in Ontario. Queens wanted me to stay there, and they said, we'll give you a temporary license. I said, no, I'm not on any temporary license. Either I come as a full member or I don't come. Simple. But they changed in '67 the rule. So I was one of the first ones from India or Pakistan to get a license, along with a fellow named George Varghese, who was a neurosurgeon in Saskatoon. You remember that?
Yes.
Yeah. So anyway, but the hurdle was a little more difficult to get the licensing exam, which I had to pass. For that, I required an enabling certificate. Some province is sponsoring me that he can appear in the exam. Now, meanwhile, I was recommended to contact Saskatchewan and BC, and as I said, Kingston wanted, one person wanted me to stay here, one didn't want, but anyway, but nobody except BC would give me a certificate that I could appear in the exam. And I was poor, very poor. I don't know if I told you, when I came to Canada, I had less than $100 in my pocket. A Volkswagen, some books, that was it. But anyway, so BC agreed to give me a certificate that I could appear in the licensing exam. But for that, I had to travel from Kingston to Vancouver. And the interview was, and they were very kind to me, said, "You're Dr. Rajput?" I said, "Yes, sir." I said, "You passed your Royal College fellowship exam in neurology?" I said, "Yes, sir." "You want to appear in the license exam?" "Yes, sir." "Good luck." That was the interview. So they were very kind that they at least gave me the chance. So I appeared in that exams and I passed. Meanwhile, there were negotiations going on with Saskatchewan, and they a bit of gamesmanship, but nothing major. So we agreed that I'll come to. They invited me in May. Now remember, if you ever want to invite somebody to join you there, invite in May. Good time of the year, beautiful weather. So I remember going to a restaurant with these guys, and got out at about 8 o'clock, 8:30, and sun is still up, and you could see flat, absolutely flat, and it reminded me of Sindh where I was born, where you could see the sun going down, down, down. So I wasn't married, so it really didn't matter to me. I was the only one who was going to decide. So I said, "What am I looking for? They look like nice people. This is a nice place. What am I looking for?" So I said, "Well, I'll come for a year." So after I was there for a day or two, I said, "Okay, I'm here for a year." So I thought, meanwhile, I'll find out what the rest of Canada is and then move on.
I've heard that before from a few people in Saskatoon where they say, "I'm just here for a year," and they're here 20, 25, 30 years later, or they come there because their spouse or someone else is doing a program. So you were unattached here for a year, and that's 1967. You're still there 44 years later. How did that year extend to 40 plus years?
Well, the second year was a very personal thing. When I told you that I had no license here in Ontario, and in September of that month, they said, "You can have a license." So they gave me a license. In late September, I went to the head of the division of neurology, who was also head of medicine, Dr. Bailey. I said, "Dr. Bailey, I have a contract with the university for a year, and I will fulfill that. But I'm going to be looking for positions, so do not be surprised if somebody asks you for a letter of reference." And that was up and up, it was all agreed upon. So he said, "Well, that's nice of you to tell me about it. They could have fired me at the end of the year anyway, But he said, that's nice of you to tell me, but don't make any arrangements for the next 2 weeks. I'm going to go out of town. When I come back, I want to have a serious chat with you." I said, "No, I wouldn't be making any decision in 2 weeks. That's fine. When you come back, we'll talk." So he went to States. He had moved from Mayo Clinic to Saskatoon as head of neurology. While he was visiting Rochester Mayo Clinic, his friends, he died. Suddenly, he was a man in his 50s, he died. Now, that's the only communication that I have had with anyone that I will be leaving. Well, who is going to be the next head of department? And they appointed a fellow named Dr. Harlick, who is a good friend of mine. He's still around. So after they appointed him, I walked up to Dr. Harlick. I said, Dr. Harlick, I had told Dr. Bailey that I'll be leaving at the end of June 1968. So I just want to let you know. just in case we want to look for somebody else. So he was so distressed at the news. He said, one neurologist is dead. One wants to leave. Where am I going to find people? I didn't even want to be head of the department. They forced me. And here's two of us sitting. He said, settle down, settle down. I'll give you one more year. So that led to now from end of June 68 to end of June 69. So that's strictly, I wasn't married, so it was okay. I could make the decisions. Well, in that year, I met my future wife, and we were married before the next June came. Now, I had to do a little more consultation. I said, I can't jump now on my own. I had to ask my wife. But I should tell you that staying there was equal credit to my wife, if not more than to me. When I was hired in Saskatoon, my salary was the lowest of any university in Canada. Queen's paid $18,000. Saskatoon paid, get what? $12,000. That was a salary scale. But I didn't know any different. I never negotiated anything. I had no idea. But anyway, so when we were dating each other, my wife and I asked her to marry me, but I said, before you say, yes, I want you to know what I make, just so you wouldn't be under any illusions that you're marrying a rich doctor. So I told her. By then, of course, they had raised my salary by $3,000 more, so I was now at $15,000.
So a full financial disclosure here before.
That's right. So I told her what I made. So she asked only one question. She said, do you like what you do? I said, yes, I do. Now remember, I was raking money in Pakistan. And now here I am happy with $15,000 a year. So anyway, so she said, if you like it, go ahead and do it. We'll make do. So she made bigger sacrifice than I did. I was at least having fun, I was doing what I wanted to do. But she was foregoing the income that she could have had. I was offered 3 times that much salary on the day that I accepted this job in private practice.
So again, I can see your business skills coming through.
It's genetic, I can tell you that. I know what you did. You give up 90% salary raise and you stay there. So you can't blame me for that. But anyway, so the life became a little more complicated because now I had a wife and I had to consult her if we moved. And I was thinking of moving. By then I had been out of States for 3-4 years. I was thinking of moving back to States. But then suddenly a new wrinkle appeared. We were only married for 6 weeks. My wife was the only child. Okay. Her parents lived in Winnipeg and we were living in Saskatoon. 6 weeks later, her father died suddenly. He went to work, had a heart attack, he died. And her mother was not in very good health. So now we had a choice, what do we do about her mother? She was not very old, but she wasn't in good health. So I talked to my wife. I said, I thought of what would I do if it was my mother in that situation? The answer was, you will offer her help. Whatever we can do, we'll do. Well, if it's not my mother, it's my wife's mother, how is that different? So I went to my wife and I said, if your mother wants to move to Saskatoon, I'll welcome her. We'll do whatever best we can. And she can live with us if she wants to. So they had some family in Winnipeg, and she didn't really want to move. But then she had the only child that was in Saskatoon. So she moved to Saskatoon with us. Now life became even more complicated for moving. So one thing led to the other, and meanwhile I had established a movement disorder clinic and center, which was going very well, and I was having fun. So I was becoming much more choosy where I wanted to go, if I wanted to go anywhere else.
So how did you get involved in movement disorders? Because now you go through residency, there's usually a year of fellowship, sometimes 2 years with basic science, and you're coming out as a potential neurologist. I'm just asking, how did you get that? Did anyone mentor you, or was it just filling a need, or how did that come about?
Well, there was an interest in movement disorder. I was an undifferentiated neurologist. I had done EEG, EMG, and the whole works, that you know. And I could pretty well handle anything that I wanted to handle, specialized. What happened was in 1967, that's the year I moved to Saskatoon, there was a major development. Major development actually happened in 1960 and 61 when Ole Harnikiewicz showed that there was lack of dopamine in the brain of Parkinson's patients in 60. And a year later, in 61, Berkmeyer and he reported that intravenous levodopa was helpful, and they had some videos to show. But because it was intravenous levodopa, it was not practical to treat people. In 1967, George Katsias, who was from New York, he reported that a large dose of DL-dopa, up to 16 grams a day, if you gave that, patients had dramatic effect. And that, he presented at a meeting, which I was not present, but apparently the film, it caught like a wildfire. Everybody was excited about it. So I had just moved to Saskatoon. I didn't know much about it. And one very prominent figure was Canadian named Andre Barbeau.